Okay, so good afternoon. Once again, I'd like to express my appreciation to Shant back there and the Office of Extension for allowing us to record the presentations for Public Health Practicum the first time since we've been teaching this course over the last 6 years or so. He sent already the link to the first two lectures that we presented, and I will put that on our website. The acoustics was a little bit odd because I was moving around so much. So today we have the microphone taped to my shirt, and that should improve things. But it also means that if you're getting out of your seat and coming in and out, please do so quietly, or if you're tapping on your computer, please try to remember that we're recording this and we want the best quality possible for the video recordings. Today we continue the Public Health Practicum course that also fulfills the upper division writing. And we're very lucky. This is one thing we also are introducing into the course for the first time, that we bring in preceptors who have worked with our students and some of you currently for many years, sharing their expertise in public health practice and helping us integrate what we teach in the classroom, all the epidemiology, environmental health, health policy, social and behavioral health, and environmental health sciences with the real work of public health professionals out there. He comes to us today from the American Lung Association, and he will join us after a brief introduction to discuss the functions of his organization and the role of public health training that he got in helping that association fulfill its mission. As usual, I will always ask if you have questions from last time. And as you know, if you don't have questions, I always have questions. So are there any questions about the assignments or about what we covered last week? Okay. Hearing none, let's see what you remember. So we did talk about several issues with writing, and we had a presentation from the UCI Health Sciences librarian, Bethany Harris, who gave us excellent tips on how to access the literature to target it to different types of writing assignments that you have. That link is already on our website, so you don't have to look too far. But we also talked about what happens before you actually start writing. And we defined critical thinking in many ways. So who wants to share with us what you remember about what critical thinking is? What's critical thinking? Give it a try.
Reflective reasoning about beliefs and actions.
Reflective reasonings about beliefs and actions. That's excellent. Do you do that? Do you practice that? What does that mean in practice? Reflective reasonings about beliefs and actions. That's a partial definition, but it is accurate, yeah? Do you want to expand on it, or do you want somebody else to do it?
Oh, that's all I got.
That's all you got, okay. Who else has other thoughts on critical thinking? What does it mean to be reflective about your beliefs, assumptions, when you read a document, when you're trying to formulate your thoughts and put it in writing? Go ahead. You're just smiling? Yeah.
Okay, I guess what I'll say is that critical thinking is using logic and reason to analyze a situation or a writing, or yeah.
Yeah, using logic. You can think this out and say it. You don't have to memorize any particular definition. It's really that you don't accept things on face value. You question them, you explore alternative explanations, and you question your own perspective. What kind of background do you have to make you think a certain way? All right, we also showed a diagram that presented 8 essential elements of critical thinking. We've already talked about them in this definitional issue, but I want you to be able to think them through in sequence. So how does it start when you're writing an article and you have this idea, okay, I'm going to think critically about this. I'm not just going to pour down my beliefs onto paper, but I'm going to try and proceed logically. What are these 8 elements? Somebody with a laptop, you can read it out. It's not being graded. How do you start? Okay, let's, yeah.
The first one's the purpose, goals, and objectives.
Yeah, what is your goal, essentially? You have to clarify that. When you write a proposal or an outline or think about it, what are you trying to accomplish? Okay. What's the second one?
Question?
Yeah.
Question, problem, issue.
What are the questions that you're trying to answer? Okay, somebody just read it out if you have them. Because it makes logical sequence. Okay, yeah.
Concepts, theories, assumptions.
No, not so fast. Yeah.
Concepts, theories.
Concepts and theories, which really means what preceded the kind of thinking that you're doing. Other people must have thought about things before, and what you're proposing to write may not be exactly what they've done, but there are certain ideas and concepts that may inform your thinking, okay?
Assumptions.
Assumptions, yours and others, yeah?
Point of view framing.
Point of view, which makes a difference if you're a woman, a man, young, old, you live in the US versus you live in Romania. Those are, the backgrounds that inform your point of view, but they also make it clear that you have certain assumptions that you may not have if you belong to another group, for example. All right? What else?
Information, facts, and experience.
Get the facts, get the information, do the literature review, do the background checks. Yeah? Interpretation. And conclusion. Yeah. It will help you tremendously, not just in this class, if you have those things as the framework for writing. Okay? Whether you have a 10,000-word paper to write or 500-word paper to write, you don't have to fill in all the categories. But if you try to check them out as you proceed, it will be very, very useful. I asked you to give some examples of public health issues where these elements have proven pivotal in scientific debate or policy development. We talked about some of this at the very beginning of the course. But let's pick something about information, data, assumptions, concepts, and theories. You can practically pick any public health issue, and you can see where some of these debates have either become accepted, one point of view over another, because we have more data. In another example, you might think of a situation where we made a lot of assumptions, and then over time, we started recognizing that those assumptions are not true for everybody, and we revisited the argument, and we changed our minds about the policy. So somebody give an example of a situation where any one of these kinds of critical thinking elements influenced what we do today as a society in public health. It's not even late in the afternoon. Think about your practicum side. What kinds of issues? Who's with an organization that tries to stop smoking? Yeah. What do you think about our society's movement toward, at least in the U.S., no smoking in terms of critical thinking? Which ones of those things do you think were influential, the elements?
Of the 8 essential elements?
Yeah.
I think point of view would be interesting.
Okay.
To take into account, because you have to be able to understand the point of view of like the Senate, the councilmen, of the actual smokers and their rights.
Mm-hmm.
Also, like parents of children who have asthma and other conditions. So you have to take in all the points of view in order to work towards one main goal.
That's an excellent point, because we often, in the U.S. at least, and maybe even it's California, we're now so convinced that smoking is bad, not just for the individual smoking, but secondhand smoke. And so we make laws saying you can't smoke near buildings, you can't smoke in the airplanes, you can't smoke at public places, restaurants. Those points of views were not accepted for a very long time because of this issue you talked about, individual rights. And so if you're a smoker, you see society infringing on your rights. And to write an article about behavior change surrounding smoking without thinking about how somebody might perceive that policy to restrict smoking would not be a complete article. And critical thinking really just means that try to think about the alternatives and integrate it into your article and acknowledge the differences, right? Anybody else has an example they'd like to share? Yeah.
Well, I'm interning at ASF, AIDS Services Foundation, and when I talk to people about oh, that's a gay man's disease, or that's an IV drug user's disease. Actually, most of the clients I encounter are heterosexual women. They make up 13% of cases here in Orange County. So the thing is to integrate, HIV prevention and other STD prevention into women's health, because it seems to be lacking.
In the 1 minute that you talked about HIV prevention and who's affected, what the numbers are, you've probably covered 4 or 5. Because at the beginning of the epidemic, there were lots of assumptions that were not questioned about, yes, it's only affecting gay people. We didn't even understand the biological basis of it, and some people immediately thought it's, I don't know, punishment from God or something. Now the data, remember, collect information, which is what we did over many years to figure out the issues with the origin of the virus, how it spreads, and what we can do for prevention. And even today, there are still controversial topics. Issues about contraceptives is very controversial, but you have to acknowledge that people have different points of views. And those things have implications for how we implement policy on prevention of HIV infection. Okay, that's wonderful examples. But you can all think about examples where you pick a topic, you could trace the history of controversy because people are not willing to question assumptions. They don't have the correct data. They have the correct data, but they reach the wrong conclusion. They omit or neglect different points of views. So those are extremely important. All right, let's go to the third one. What are the 4 most common types of op-ed articles? Since this is an assignment that's due soon. Go ahead.
There's a first person.
Yeah, when you're talking about your own experience, first person.
There's event-based op-ed articles.
Anniversaries, events,
Holidays.
Public Health Week. Okay.
There's declarative.
Declarative, what does that mean?
I forget what that one is.
Yeah, you're declaring a very strong point of view that may disagree with everybody else's, but you're saying, you know, it doesn't have to be based on your experience. It doesn't have to be tied to an anniversary. Here is what I believe we should do. Okay? And the
solution-based?
A solution where people have talked about different problems, different solutions to those problems, and you have an idea that you think hasn't been written about before, and so you present your solution. Okay? So those are the 4 major types. All right. We didn't finish this last week, so I wanted to take the time to tell you that in any kind of writing assignment, it's not unusual to have writer's block. You know, you're just stuck, you can't go on, and I've received a few emails from some of you where I interpret what's going on as writer's block. So I wanted to you know, talk to you about this. Here are typical solutions to writer's block. Don't try to get it perfect the first time, okay? This is what they check your ego at the door before you start writing. Just write as much as you can. It may not make a lot of sense. It may appear to be jumbled. But if you let things flow, you're better off in coming back to refine it. Okay? But it's when you're trying to get it perfect the first time that a lot of people get stuck. And that's part of why we are doing drafts in this class. And the improvement on the draft is much more important than whether or not you got the draft perfectly. So writing outlines is a very good way to relieve the block. So if you are blocked in thinking, then write bullet points. And you don't have to expand on them right away, but you know, bullet points create very good outlines, and then you can expand on them later. If you're responding, for example, in an op-ed article to something somebody wrote, once you get past the acceptable boundaries of not being upset, and you're starting to call somebody's point of view or preposterous, outrageous, it blocks your thinking process. You're not able to respond critically to the argument in a logical way. So avoid getting angry about the response. And this happens especially with political topics. Read what you've written out loud. Sometimes that releases ideas that may help you move forward in your writing. Okay, so we also require that you submit op-eds to newspapers. So usually this is now accepted in email, and you shouldn't just attach it to the email with no comments. They wouldn't know what it is. They might think it's a virus. Always write a short professional letter that includes your name and phone number so they can reach you if they need to. And don't follow up with them. They usually will respond to you in an automatic reply. And if they're not going to accept it, some newspapers will tell you, others will just be quiet. But there's no point badgering them about whether or not they received it or not, because a good newspaper would have received multiple, sometimes hundreds of articles. Okay, so here is the kind of acknowledgement you would receive, and this is the kind of evidence that I use to know whether or not you actually tried to submit to get the points. You will just send me into the Dropbox. You can either, if you want to print out the email or scan it in some way to make sure that you have the evidence for getting an acknowledgement, and that will give you your extra points. Okay? Are there any questions about this? All right. So it is really a pleasure to have as one of our guest speakers this quarter. I think we'll have about 5 speakers. And they are selected from the Practicum sites represented in the class. So you shouldn't be surprised if your preceptor shows up, because I have the list of speakers on our website. We have about 75 students in the class, and maybe more than 40 different Practicum sites. So obviously we can't have all the preceptors come. There are scheduling issues, but those who've accepted, we're really grateful for their contribution to the course. Because we're recording it, it's going to be a permanent record to teach other students, to provide information on what these sites are about, and hopefully supplement what you read when you're looking for a site. So David Reynoso is an advocacy manager with the American Lung Association in California, and he works in the area of tobacco control, advocacy, and policy. He currently serves as the grant manager for Smoke-Free Orange County project. So you can ask him questions about the grant writing, which is one of the major assignments for the course, although not until the end. Prior to working with the American Lung Association in California, he served as community and policy liaison for 3 years with the Los Angeles County Department of Public Health, working with city governments on smoke-free outdoor policies, smoke-free housing policies, and policies around the tobacco retailer environment. As we just discussed, I'm sure he can tell you how controversial many of these policies were before we have them. He got his Bachelor's of Arts in American Studies with a concentration in public health from UC Berkeley. So please join me to welcome David to our class.
Good afternoon, everyone. My name is David Reynoso, and I'm an advocacy manager with the American Lung Association. And just bear with me, as this presentation is usually not the kind of presentation that I usually give, but I try to frame it in the context of how you might have learned some of these things in class, and try to frame it so that you could understand how your work or what you're learning now is applicable in the real world. So I'm going to give a little background on the American Lung Association, and also go a little more into depth of what Smoke-Free OC is, which is the project that I manage with the Lung Association. And just with a show of hands, how many of you have heard of the American Lung Association? How many of you know what we do? Not one person, our intern. So I'm glad that I'm here because to share what we do. So the American Lung Association was actually started in 1904 and is a voluntary health organization. So we are in our 2nd decade. And we are a national organization in California. We have a charter. So I'm from the American Lung Association in California. And just of who we are, our vision is that we see a world free of lung disease. And our mission is to save lives by improving lung health and preventing lung disease. And in California, we have offices all over California. We have one in Bakersfield, Chico, Fresno, the Greater Bay Area, Los Angeles, Sacramento, San Bernardino, and San Diego. We have a small satellite here in Orange County. But as you can see, our presence in California, it's pretty big. And what do we focus on? We focus on indoor quality, outdoor quality, in lung disease, and tobacco control. And in all those areas, we work in the areas of research, education, and advocacy. Just so you get a little gist of what indoor air quality means, we work with asthma triggers in the home, smoke-free workplaces, the air quality in schools. In terms of outdoor air quality, we work on issues of air pollution, transportation emissions. In terms of lung disease, the main diseases we work with are lung cancer, asthma, and COPD. And in terms of tobacco control, which is the unit that I work for, we work on smoking cessation, secondhand smoke exposure, and tobacco and its association with youth.
I have to confess that when I hear American Lung Association, I almost always think of tobacco control.
Yes.
Is that branch bigger than the others, or is that just a public perception of it?
It's probably a public perception because of the controversial aspect with it. Yeah, and especially in California, since we do have a lot of restrictions in smoking throughout the state, that's what we are known for. But we do have huge components of air quality specifically. And actually our State of the Air, which is our report that talks about air quality, is actually going to be released in a few weeks. So you might hear about it in the newspaper. And why is tobacco, so in the unit that I work for, the Tobacco Control Advocacy, I'm just going to give a little background as to why we focus on tobacco. And tobacco is because it is the leading cause of preventable death, and it causes 1 in 5 deaths in the United States, which is more than HIV, illegal drug use, alcohol use, vehicle injuries, suicides, and murders combined. In terms of secondhand smoke is in the same category as some of the most worst industrial air pollutants. And secondhand smoke has higher levels of toxins that are found in inhaled cigarette smoke. So it contains over 4,000 chemicals, 250 of them are toxic, and at least 69 of them can cause cancer. So what's in secondhand smoke? And I'm sure you all know this, so I'm going to go with this really quickly. There are chemicals, gases, and metals such as aluminum, acetone, ammonia, arsenic, carbon monoxide, ethanol. So a lot of chemicals that are obviously very harmful to our lungs. And in 2010, the US Surgeon General declared that there is no risk level of exposure to secondhand smoke. And this just happened 2 years ago, so it was a landmark decision. So that is why we work on restricting smoking, specifically in areas where children might be exposed. And the health risk associated with secondhand smoke. In children, we see an increase in chronic ear infections. There is in terms of respiratory symptoms, there is an impaired lung function. It is an asthma trigger, and there's also an association with SIDS. In adults, we see an increase in nasal irritation. It is associated with lung cancer, coronary heart disease, and in women, it is associated with low birth weight. So how have we made a difference here in California? And the Lung Association spearheaded the initiative in 1988, Prop 99, which increased the tax by 25 cents on a pack of cigarettes. And since then, we've saved over 1 million lives and saved over $186 billion. And because of Prop 99, the California Health Department started the Tobacco Control Program. And that is where a lot of programs are funded to do work around tobacco control. And since 1988, today we have a lot of us would refer to California as America's non-smoking section because we do have a lot of smoking restrictions.
Sorry, I missed the quarter.
The quarter that changed the world?
What's the quarter have to do with?
The Prop 99 increased the pack of cigarettes by a quarter, so 25 cents. And if you have any questions, let me know. I'm more than willing to answer them as I'm going. And something that we do with the Lung Association is that we release a State of Tobacco Control report every year, and it's released at the beginning of the year. And the State of Tobacco Control grades all the 50 states in the United States. I think it's 51 actually, since we include, what's the state? Puerto Rico, I think. So, not state. What's the 51?
District of Columbia?
Yeah, District of Columbia, yeah. So we include District of Columbia, that's 50 words, sorry. So we grade all of them based on the tobacco control efforts. And in California, we actually release a special report where we grade every single city and county in California. And we grade them based on different tobacco control measures that I will go over right now. And here is what the report looks like. And I'm putting the city of Buena Park as an example of what we do with the grades. So we grade each city on their smoke-free outdoor air policies. So if they restrict smoking in dining and entryways and public events, in parks and service areas such as ATM lines, sidewalks, which usually would mean like a business district area, so the sidewalks where there's a lot of kids that are passing by, work sites, which would be kind of construction sites would be an example. If they have smoke-free housing, so if they have non-smoking units, if they prohibit smoking in common areas, if they have disclosure, that means if the landlord is supposed to tell the new incoming tenant if the unit next to them are smoking, if they declare secondhand smoke a nuisance. A lot of cities declare it a nuisance, so then a citizen can do something if secondhand smoke is becoming a harm to them in their home. And also in terms of reducing sales of tobacco products, a lot of cities choose to pass a local tobacco retail licensing. So they license every single retailer in the city, and it they have a local enforcement, so there is less sales to youth. And you'd be surprised how many cities that do not have this tobacco retail licensing ordinance, how many retailers are actually willing to sell. When I was working with the Los Angeles County Department of Public Health, I was working in some communities that are south of downtown, and we took youth to go and attempt to buy cigarettes to these stores. And in one specific city, we had a selling rate of over 50%. So that obviously fueled for us to go to city council and for them to vote for a law that would enact the local tobacco retail licensing ordinance to decrease that number. Because the state is so big that the enforcement that we have at the state level is, I think they're able to go and do compliance checks about 3% of the entire state a year. So then by the time, so retailers are not really disincentivized to not selling to youth.
Sorry.
Yeah.
So that's a very interesting point, because even though there was a state law, the local police were not enforcing it until they had their own local laws. Is that?
No, so every retailer is supposed to be licensed by the Board of Equalization, so they get a license through them. But the enforcement mechanism is a STAKE Act, but then the STAKE Act program is not funded well enough to go and do compliance checks all over the state. So that's why the American Lung Association focuses on that one, because we know that reducing the sale of tobacco products at the local level is very effective. And also some schools, some cities that choose to have a tobacco retail licensing also limit the sale of tobacco near schools or parks, and that can be done at the local level. So I just have a trivia question. How many cities do you think in Orange County received an A in the State of Tobacco Control Report? And Cami, my intern, cannot answer this question. She would know. So how many? Any guess? How many received an A out of the 34 cities in Orange County?
3.
3? Any other guess? 25%? Actually, 0 received an A. How many received a B?
7.
Again, 0. 0 cities in Orange County received a B. How many cities received a C?
Or maybe you should tell us what does it mean to get an A? Meaning
An A meaning that they do
all of this.
Yeah. So each area, it's broken down more if you go to stateoftobaccocontrol.org. So there's different points assigned to each, under each policy. And at the end, we get just the same way a grade is calculated. And Buena Park has absolutely no policies. So that's why they have a fail. They have F.
So between A and F or G?
Yeah, so no city in Orange County has an A. No city in Orange County has a B. How many cities have a C?
One.
1? There's actually 3, and that's Laguna Hills, Laguna Woods, and the city of Santa Ana. Yeah, so there's not that many. So that's why we have a lot of work to do here in Orange County. And of course, there's a lot of implications as to why perhaps Orange County might not have many policies. And something with Orange County is that it is, in general, a very conservative county when it comes to public health. So that could be a reason. And just to give you a little overview of the top 10 cities in California in terms of population, only Oakland and San Francisco actually have a B, and none of them have an A, so we have a lot of work to do. And that's what we're doing now. How long have I been doing this?
Yeah, given the cities.
Oh, we've been doing this for, stumped on that question, but it's been maybe like more than 5 years for sure.
So one of the consequences that the grades still stay the same?
The grades just stay the same. So every year we release the report, we release the press release, and we give this report to all the cities and counties that were graded in California. And this is actually a report that's just unique to California. The Lung Association does not do this for every state in the United States, but the California chapter designed this report. So we're doing this only in California, and it's up to the city to do what they want to do. I mean, a lot of cities actually have been, when they saw their Fs, they want to improve their grade. So then they contact the Lung Association. They're like, how can we improve our grade? What can we do? So then we work with them on developing the policies that will protect the residents from secondhand smoke and smoke-free housing and tobacco retail licensing. But we use it as a way of moving policy throughout California.
I'm maybe it's my prejudice, but I'm very impressed with Oakland. I mean, it's the best on this list, and
Yeah.
I wouldn't have guessed it.
Yeah, well, actually, one of the Bay Area in general has a lot of tobacco control policies in place. And Oakland, actually, I was actually in a conference maybe a year ago where Oakland has a very, very strict tobacco retail licensing ordinance. So when they adopt the tobacco retail licensing ordinance, that actually puts the grade a lot up because that is a priority in the 3 areas that we look at. So yeah, they have an A in tobacco retail licensing.
And B in everything else.
Yeah.
I mean, as a public health professional, usually this is a very good proximate endpoint, but the ultimate goal is reduction in lung disease. Do you have programs that then look at these cities as they improve their scores? It may be too soon.
Yeah.
That ultimately this should result in a decline in lung cancer cases.
What we do see is that there has been a reduction in the smoking prevalence in California. Every year it has continually come down. And we know that all these policies do affect people to enact their decision to quit smoking. So that is one positive effect that we've seen. I don't know if we could ever quantify how many people are not being exposed to secondhand smoke or not. Unfortunately, that's just the way it works. Yeah. And just to give you a little overview of the policies in Orange County, it doesn't have too many and not many cities have good grades, but out of the 34 cities, there is some restrictions in parks. Here's a small list: Fountain Valley, Costa Mesa, Laguna Beach, Laguna Woods, Seal Beach, Santa Ana. And the ones with an asterisk, which actually includes Irvine, it's that it's not a comprehensive ordinance. They don't restrict smoking in all parks. It's usually, they might have designated areas. There might be certain parks for whatever political reasons. And then in terms of outdoor dining, Laguna Hills, Laguna Beach, and Laguna Woods are the only ones that restrict smoking in the patios of restaurants. So what is Smoke-Free OC? Smoke-Free OC is actually a grant that we received from the California Department of Public Health. And it's actually the project that the 2 interns that we have from your Practicum class are actually actively working on. So this is the work that they are getting involved in. And our goals for Smoke-Free OC is to reduce exposure to secondhand smoke in outdoor areas in Orange County, and also to require licensed childcare homes to be 100% smoke-free at all times. And our objectives are that by June 30th, Buena Park, Costa Mesa, or the City of Orange will pass a comprehensive outdoor smoking policy. And our second objective are that by June 30th, 2 cities will pass or adopt a policy that requires licensed childcare homes to be smoke-free at all times. So our grant is actually ending at the end of June. It was a 3-year grant, and we are in the process of applying for an extension, so we might get 2 more years. So we could have 2 more Practicum students come in next year. And what do we mean by smoke-free outdoor areas in terms of comprehensive? We mean that they restrict smoking in dining areas and entryways, in parks, public events, service areas, sidewalks, and work sites. So it just needs to have 5 of those 7 listed.
So that includes like private property and everything like that?
Private property, no.
Areas?
For dining areas, yeah, so like a restaurant, you mean?
Yeah, like if it was, on private property.
Yeah, so we're talking about the dining patio outside in a restaurant. The inside of restaurants are already smoke-free by state law, but we are working on trying to restrict smoking in the patio. And just 2 years ago, the city of Los Angeles passed this ordinance in one of the biggest cities in California that had passed it. So you can't smoke in the dining patios of most restaurants in LA. And in terms of licensed childcare homes, what do we mean? A lot of times it just might come to a surprise, like aren't daycares supposed to be smoke-free? So daycare centers are supposed to be smoke-free around the clock, but we are focusing on daycare homes. So daycare homes are a little different. They are home-based businesses that have their daycare out of their home, and usually they are for daycares that are less than 14 kids. And they are only supposed to be smoke-free during the hours of operation. So our goal is to have them just be like the centers where they are smoke-free around the clock, because we know that if people smoke after hours, there is lingering smoke in the carpets and the curtains, and that, of course, is harmful to children, because children tend to crawl around and put their hands in their mouth, etc. So that's what we're working on. And I wanted to put it a little more into context of kind of more an academic spin to it. This is usually not the way I operate. So the way we do a lot of these policies is by using the policy adoption model. And the policy adoption model has 5 phases. So first, we do a community assessment. Then we do a campaign strategy. So a lot of these policies that we're trying to pass are at the local level. So this is a local campaign in a specific city. And then we do coalition building. So we are really trying to get the community on board. This is a very grassroots effort. And then phase 4 would be campaign implementation and policy adoption. So really trying to develop what kind of campaign we're going to have around this, and how trying to get the city council to adopt the ordinance. And phase 5 would be policy implementation and enforcement. So if we pass a smoke-free parks ordinance, how does it look like in terms of signage? How many signs are we going to have at the park? Where are we going to put these signs? Who's going to enforce it? Are there going to be citations, et cetera? And in terms of community assessment, we do extensive research on every single city. So if we're doing, let's say, a campaign here in Costa Mesa, we would do key informant interviews with different leaders throughout the community, just getting to know what their opinions are. We do policy record reviews, so we look into the policy of Costa Mesa, and we would see if there's any record of any tobacco control, health-related policy that the city has taken action, because that would give us kind of a understanding of what kind of city in terms of public policy. We look at media records, so looking to see if there's any kind of articles out in, let's say, the ORC Register on smoking, if there's any articles related to smoking fires, etc. We look at the health profile, so looking at the smoking prevalence of each city. We look at the asthma rates of each city. So if, some of the cities that I've worked in the past, in Los Angeles, there were cities where there was a really high prevalence and really high hospitalizations rate in terms of asthma. And the entire community was also very much living in multi-unit residences. So having a smoke-free housing unit, smoke-free housing ordinance there made sense. And also, one of the biggest ones, and probably most important one, is decision makers, really trying to see who is in the city council. In order for us to pass a policy in a city, we need the majority of, most councils have 5 city councils, so we need at least 3 votes. So if we have 4 smokers in the council, it might not look too favorable on us to go and pursue a campaign there. We also work a lot with public opinion polls, so we go around the community and survey the community on how many people support various policies. So this one is actually a report for smoke-free outdoor areas. So we ask people their support on restricting smoking in patios, restricting smoking in the parks, and then we just look to see how many people support it so that we could give this to City Council. Question?
You said this is, you just need the support of the City Council. You don't need like to go through a vote or anything like that, right?
Go through a vote by, like a general election vote?
Yeah.
No.
So what kind of like law is that called?
So the City Council has the authority to pass local laws, and they're voted in by the voters. So the voters give the authority to the City Council to pass laws that will improve the health or the community. So it doesn't have to go through anything like that. The only thing that would have to go through vote by a city, I think, would probably be like a tax. Yeah. Okay, so that's the public opinion polls. We work a lot on building coalitions throughout these cities, so trying to do educational presentations throughout various organizations in the community, going to schools, giving presentations on tobacco use and the effects of secondhand smoke. We do spokesperson training, so we train community leaders and the community in general to go and advocate for the change that they want in their community. So we have that. We also attend community events, community meetings, health fairs, trying to be really integrated into the community and have a presence there. And usually by the end of our work or campaign there, we have a solid coalition where a lot of times they're named completely different and they advocate for other things other than tobacco. Here's one picture when we were trying to get the council to pass a smoke-free housing policy. So it was a pretty big group. In terms of policy adoption, we work, there's obviously a drafting of the ordinance, how the law is going to look like, and it's adopted by the city council by vote. And during the city council, usually it has to pass first and second readings, so 2 readings. And we usually have public testimony and get letters of support from the organizations around the community that support this, and also individuals. And here is one of our successes with Smoke-Free OC, which was in the city of Costa Mesa. And the city of Costa Mesa, we were not able to get a comprehensive ordinance, but we got something. And it was an ordinance that restricts smoking in all city-owned parks, community gardens, and sports facilities. So it affected 36 areas in the city. And it passed maybe a year and a few months ago. So all the signs are already up, and it's working well. And that concludes my presentation, if you have any questions.
That's excellent. So you're all going to get a test on what the policy adoption model is. So if you're not clear, ask questions now. We have time for a few questions. Yes?
I have a question about the 25-cent tax.
Uh-huh.
How are you able to quantify how many lives that was able to save?
That's a good question, and I actually don't know. Yeah, I'm not entirely sure.
Yeah, this is done, actually in some instances, Congress demands these kinds of numbers. If we're going to spend this amount of money, tell us, how much we're going to save. So the way it's done, I used to teach a course called Burden of Disease Assessment, is that you look at the number of cases of a disease associated with that particular cause. So, for example, if you take all of the lung cancer cases in the United States, and then you do what we call attributable risk. So some of those lung cancer cases may be due to tobacco smoking, some may be due to asbestos exposure, some may be due to outdoor air quality. But quite often, epidemiologists can tell you what fraction of all lung cancer cases are due to somebody smoking 20 packs a day. And then you look at the healthcare cost. How much does it cost the state or the county or the US government to treat one case of lung cancer, whether it's surgery, donation, transplantation, or chemotherapy. So they know how much each case is worth. So typically the US Environmental Protection Agency will make a law to reduce, let's say, ozone level in the air. And then they look at disease decline over time, and then they can tell you how much was saved because of that law. So if you raise the tax by a quarter, then you show a decline in the number of smokers, then you see a decline in the number of cases of disease, and then you know how much it costs to treat one case, then you essentially do the arithmetic to.
And the Prop 99, the administrator of Prop 99, they release a report every year. So you could go to the California Department of Public Health, and they will have a report. And I'm sure they probably included a methodology.
Have some number.
Yeah, some methodology on there and how they actually get that number. But yeah. Any other questions?
Do most of the county health departments have like a tobacco control department or task force, or is just like that? Few large counties?
Most counties public health departments do have a tobacco control and prevention program of some sort, and it's usually funded by Prop 99 and also funded by the Master Settlement Agreement. But Not all of them are as extensive as others. I know from my experience working before working for the Lung Association with the Los Angeles County Department of Public Health, their tobacco control program was very well organized and very big. So that's why there's a lot more cities with A's in LA County than there is in Orange County. Orange County is a lot more on the conservative side. So not a lot of city councils are actually willing to pass these policies because they focus more on infringing people's rights, or overarching government, nanny laws. So yeah, those.
That's very typical of public.
Yeah, very typical of public health. Something you're really gonna learn. Yeah.
The politics of the region affects what kinds of policies.
Especially if you're going into public health policy, and the next big thing is going to be trying to tackle our obesity epidemic in the United States. And a lot of obesity policies that we are looking at exploring are very much considered nanny policies, or yeah. So.
And, yeah, if I can add to that, at the state level, for example, well, at the U.S. national level, there is, I don't know how many people have heard of Healthy People 2020. Yeah, so there are targets. So California has a target for how many cases of lung cancer we want to reduce by 2020. So if they do an assessment at the city level, county level, and they figure out we're not reaching our target because in Orange County, people are not as educated or have some kind of political reasons. So the state may decide to put more money in those places so that overall we meet the target. But you have to be able to target your investment in places where the biggest problems are.
Yeah, and the project that I was working on with LA County was actually, it was a CDC-funded project coming from the prevention money under the Obama administration. So that's how the Los Angeles County was able to receive a huge sum of money to do a lot of this tobacco control work. And it was very successful, so yeah.
Can you say a little bit about your day-to-day, I mean, you said something about writing a grant to keep the one you have going, and probably you have other grants. And so in your work, I see a lot of writing. Not just the reports, integrating the data, collecting the surveys, reading what's published in the newspapers. And in addition to the work they do at the agencies, they also have to write op-ed articles, scholarly reviews, and grants. And I think we've tried to impress upon them that the work of a public health professional in many cases is really about writing. But maybe you can give us some assessment of how you distribute your time across all these functions.
Across all these functions.
It's a big question.
Yeah, it's a big question.
Yeah, what keeps you busy or up at night?
I mean, so since I do operate with a grant from the California Department of Public Health, there are progress reports that I have to submit every quarter. So every grant comes with certain deliverables that I have to complete by a certain amount of time. So this is actually a 3-year grant, so we've had to conduct so many presentations, conduct so many outreach to so many people, conduct so many meetings. There's a certain number of target that I have to hit every certain amount of months, certain amount of press releases that I have to issue, certain amount of op-eds that I have to issue, certain amount of, so every quarter I have to report to the state what I did and how I did it. And if there were any obstacles, also tell them what obstacles I had and what challenges or barriers I had. So I'm actually relatively new to the grant because the grant started, it ends in June 30th, but it started 3 years ago, so, or little less than 3 years ago. And there was a vacancy in my position. So my position was vacant for maybe 9 months. That was a really long time. So now I'm having to catch up and report to the state exactly what's going on, how I'm going to catch up, how I'm actually going to meet my deliverables. So yeah, it takes a lot of writing and a lot of reporting that comes with a lot of this. Aside from executing the whole work, there's a lot of, and then at the end, I was going to actually include some slides with about that part of the project, but I decided that it was probably too heavy. But it was, we also have an evaluation component to our project. So we actually work with 2 evaluators from Cal State Long Beach. So they develop our survey instruments. So our public opinion polls are done by an evaluator, and they let us know where should we go and survey so that it's statistically, I guess, representative of the city. And they evaluate our surveys, we get the results, and then at the end, we're also gonna have to do an evaluation, which is actually due June 30th, so I'm gonna be very busy all of June, trying to write a report of summarizing the past 3 years and write our story on how our successes and our maybe not successes, and what were our challenges and barriers and et cetera. So it's going to be a long report. So we have an evaluation component and then us just finishing our deliverables. So grants in public health, that's just what it is.
Name of the game. Any other questions? Okay, please give a round of applause. All of the students are expected to interview their supervisor, and that's due in the Dropbox tomorrow by midnight, 11:59 p.m. And also outline of scholarly review. I gave you some ideas about how to write that outline. Yes.
I have a question about which folder we upload the outline of the scholarly review article, because there's one that says outline of article and one says article review.
The outline, you put in the outline. When you have the review, you put in the review. When you have it, the outline belongs in the outline. So
Okay.
that's, okay? All right. We can't do all of them, but I always like to share some experiences across the students who hopefully have done these assignments. And the first person I'd like to hear from is the intern working with. So, Kami, you did the interview already?
Yes.
Okay, tell us while he's here so that he can correct any misperceptions you have.
Oh, the actual interview.
Yeah, tell us the general, questions you asked and the responses. Oh, good.
We conducted it earlier today. We weren't able to meet up in person until today from last week. So I just asked a couple of additional questions to the one that you suggested in the lecture. So I just wanted to know just the background of his credentials in education, what really got him into public health, and do you want me to?
Yeah, tell us, what did he say when you said what got him into public health?
Well, I typed up the transcript on my laptop, which is on here, but
What do you remember? Just share.
So, American Studies, bachelor's in American Studies with an emphasis in public health. He also, this is from UC Berkeley, sorry, and then he had some experience with the African American population. So incarceration rates of African Americans in relation to HIV.
Mm-hmm.
He did some work of that in his undergraduate career. And then a couple of years after, or a little bit after graduating, he started working at the LA Department of Public Health, where he worked, just what he said in the presentation, working on tobacco and indoor housing and public housing, things like that. So that's how he first got involved with the American Lung Association, was because he was working with that department. So he also had to collaborate with American Lung Association, American Heart Association, Cancer Association. And so when he found an opportunity with the Lung Association at the end of the 2.5-year grant, he switched to American Lung Association. And so I also asked him what his ultimate career goals were.
Mm-hmm.
And so he said that he wants to go into public health nursing.
Mm-hmm.
So he's looking into pursuing a master's in nursing because in his experiences working with the Department of Public Health, he interacted with some public health nurses who had that clinical background and that nursing background so that they could help further with like smoking cessation
Right.
or an individual level along with their community level, so he wants that background in public health and nursing. And then we discussed the goals and objectives of the American Lung Association. So
he presented. Well, did you ask about challenges that the association?
We talked about the major challenges, and since it's a nonprofit organization, money is always
Right.
a big issue with funding, and you can't really do the research and all of the programs without a little bit of funding. So to remedy that, he said that we do a lot of fundraising, which I was able to experience a little bit, and also another challenge is, he also mentioned it, was the decision makers and how they have a huge influence, and how also a lot of them might not be well educated on what we do as American Lung Association and all of the issues. So he said that we can remedy that by going to them and educating them, having appointments, and kind of giving them presentations to bring these problems forth so that they can make decisions and help with policies.
Okay. So, David, what grade should she get? A very good grade.
And to add to the decision making
Yes.
thing, we do have, in our tobacco control efforts, we have like what we call district days, and then another one called information and education days. So district days is meant for us to go to the district offices of the assembly and the senators in California, and we go and talk to them about how tobacco has impacted California and how much money is being spent into tobacco promotion and just the basic, all the issues that we have locally, and to get it on the radar. And then because there's also obviously a whole, I'm working on local level policy, but then there's also state level policies. So
Right.
we're working on the same issues, but at the state level. So we also, and as new senators come in, or we have to educate them also, because
Right.
yeah.
Yeah. Well, one question I used to include in the interview question is how does academic training, what you've learned in class, how can it help the mission of the organization? And you clearly presented that in the policy model. I think, I don't know, those in the public health policy degree should have heard of that in the health policy course that Professor Mukamil taught. But there are so many ways in which the theoretical concepts are applicable to the practice. And we always think about how do you formulate research, and the questions that come up are the questions we put into grant proposals to get funding to study those problems more. Well, thank you. Yeah.
And then to add to that, I guess, the whole policy adoption model, I used it from my background.
Right.
It's not something that I learned
From the job. Yeah, yeah.
So,
That's
my background in public health when I studied in Berkeley, that definitely came in handy. And then also just when you are writing a grant proposal and then you get it awarded, a lot of your scope of work is framed in that way because we are trying to adopt the policy. So the whole number of presentations I have to do, number of meetings I have to have with decision makers are all outlined in my grant because it's kind of modeling the same thing. So the policy adoption model is modeled by the scope of work that I have to do.
okay. Well, thank you very much. So you don't have to stay. We're gonna do more of this, but if you're welcome to stay. But the other reason you might want to stay is if you can't find your way back. But we'll be done. So you feel free. If you really have to go, I can tell you. Okay. So William, is William here? Okay. Tell us again what you discussed with your supervisor.
Well, I interviewed my supervisor at the specific branch I'm assigned at.
Remind us again what the Lighthouse Community Center does.
It's mainly a tutoring program for low-income children. And so we work with children of various grades.
Mm-hmm.
And do homework with them, curriculum with them. And so that's mainly it. We do other programs and so I interviewed my supervisor and her name is Meredith. And so I just asked what her job is or what her title is, why she got involved or how she got hired. And so Spanish that she learned from her major.
What was her major?
Her major was Spanish literature.
Mm-hmm.
And so she wanted to be able to use Spanish, and she wanted a job where she could like build relationships and work with like the Hispanic community, and also work with the company that had good values. So yeah, she found all those things from the community center, and I also asked her like what are the goals and objectives of the organization. So she said to provide an environment where the students feel safe to do their work, just to come and just to feel safe.
And what are the main challenges?
Some of the challenges, so I guess the tutors that come and help the community center, they have difficulties with the language and cultural barriers that occur between the students and the tutors.
Right.
And so she has to work with that. She has to talk to the tutors and talk to the students and communicate between the two of them. She also has to, she might also have some of those problems too, but it's more rare for her because she does speak Spanish pretty well. And she's been building the relationships for a while.
So yeah, what do you remember when we talked about cross-cutting themes in public health?
Yeah.
Which one do you think that challenge applies to?
Maybe social.
There are two. What? Social what? What are the cross-cutting themes? There are 7, right? And at least 2 of them go into this particular issue you raised. Anybody can respond, actually. Isn't that one on cultural sensitivity, yeah? And communication?
Yeah.
Yeah. Okay, thank you. Sarah? Yes.
Yes, I'm interning at the Back Bay Science Center, and it's basically just an educational and research facility over in Newport Bay, and it basically has high school programs geared more towards high schoolers,
Mm-hmm.
and it just kind of is about environmental conservancy and stuff, and environmental protection. So I have 2 supervisors, so I interviewed both of them together. And I started talking, or asked them about the facility itself, because it actually isn't its own organization. It's owned by California Fish and Game,
Right.
the city of Newport, the city of Orange, or one of those 2, and then UC Irvine too. So kind of is a culmination. And we help out with the educational programs with high schoolers, but we didn't necessarily see the research side. So we asked about what they do for research, and they actually came up with a lot of the science facilities around the West Coast around here, so in San Pedro and up in Dana Point, and they actually are trying to research the algal blooms that happen, because there is really no scientific evidence of why they happen, and so they're trying to always team up together, and they always communicate with each other to measure plankton and algae and stuff like that. So it's interesting. And then the organization itself, they said that the most challenging aspects are because they work under grants from the state. The most challenging part is if they need things for their educational programs, say they just need to get a fishing net or something that they can use for one of their programs. They actually can't just go out and buy one. There's so many restrictions to the grants and the money that they get,
Right.
that they kind of have to plan ahead, or just to know what they want and when they need it, and then as soon as they get the okay, they can go. So the only solution they could really give us was that they just really need to be on top of what they need for the programs, when they need it by. So as soon as they get the funding that they get, then they can go get stuff. And otherwise, we just asked them about kind of how they got started there. And actually, one of my supervisors was a public health science major here a couple of years back. And
Probably did have practicum there and stayed.
Yeah, she back in there, and afterwards she just volunteered for I think 2 years afterwards, and then a position opened up and they actually offered it to her.
Very interesting.
So
Yeah.
we just kind of talked about networking.
Yeah. one of the things I used to teach about the Back Bay, especially with the new bird flu, I think 14 people have died now in China. It's one of the stopping points for migratory birds from the northern hemisphere to the south, and it's one of the risk nodes for transmission to people. So they may or may not talk about it because they don't want to scare people, but there's a lot of monitoring going on, and I'd be surprised if the state doesn't continue to fund them. All right, thank you. Nagme?
Yeah, so I asked her the goal of the organization, which it's an innovative treatment facility that helps treat patients that suffer from neurotypical disorders, like ADD, ADHD, autism, and Asperger's disorder, and other stress-related disorders. For the challenges of the organization, she said that sometimes the patients aren't able to come out with the best possible outcome. That's because each patient is different and they learn differently from each other, so they have to condition their brain in different ways. And they do this through additional testing, and they use a process of brain mapping to determine which brain waves aren't functioning, and so they can improve on those certain ones.
What was her background training? What kind of degree did she have before she started working there?
I didn't ask her that.
You should ask about her training. Okay, you can add that later, but don't not submit because you don't have that information. Okay. All right, thank you. Andrew?
Yeah, I interviewed my coordinator of our study that we're doing at Second Harvest Food Bank. First, I just asked her about like her background, like how she ended up at the food bank, and also like what projects or work she's done before. While she was in school in college, she was a member of the Surfrider Foundation in San Diego, which is a marine conservation nonprofit organization. And then after she graduated, she traveled around like Central America, and she ended up working in Honduras and Panama for 2 years. She worked with an organization that focused on sustainable agriculture. And then after she stopped traveling for 2 years, she came back to America, and she heard about the opening at Second Harvest, and she had an interest in public health in relation to food and nutrition. So she thought it was a good opportunity to learn more about food banks and how they help support hunger relief. After I asked her about her background, I just asked what are the goals of Second Harvest Food Bank, and she said the ultimate goal is to end hunger in Orange County, and the way they do that is they work with wholesale food distributors like Ralph's or Albertsons. They give them food, and then Second Harvest gives that food to other nonprofits, and then those nonprofits they have support programs like soup kitchens and stuff, which distributes the food to people who need it. I asked what the challenges or obstacles were to the function of Second Harvest, and she said, I think the biggest issue was that it's difficult to be like kind of on the forefront of like advocacy for like change in terms of like the community and society, because they're more of like a middleman, I guess. Like they get the food from like distributors, and then they give the food to people who are actually running the program. So
they don't, meaning they don't work with individuals who are in need. Yeah.
So that was one of the biggest challenges. And then I asked what measures or approaches are being used to resolve the challenges, and she said they have a program department at Second Harvest, like that actually runs programs similar to what other nonprofits run, like whether it's like soup kitchens or brown bag meals, like given to people, and they're trying to expand their food bank, or not their food bank, but those programs, so they can be more, I guess, hands-on in the community.
Okay, thank you, Rebecca. Becca, you said.
Interview the program director at the center, and the goals, self-explanatory. They want to create a safe space for LGBT and allied students through educational programs, safe zones, which are like open forums for everyone to talk. And we have program weeks, like this week's Pride Week and Web Visibility Week. major goal of everything is just visibility, letting people know that we're here and active part of the campus. Challenges, budget, like everything else. They used to offer paid internships and student assistant positions, which they won't be able to do anymore starting next year. And a challenge is just serving the whole campus, not just LGBT students. How they try to resolve these challenges is just starting small, like they succeeded in creating a preferred name field where students can like go to the register and change their name on roll sheets, whatever they prefer to go by. And
as in aliases or like legal change of name?
I mean, like if I prefer to go by a more male name, I could go somewhere on campus or whatever.
And make the change, so everybody, yeah.
But not like legal.
Yeah.
And she would really just wants to stress that it's a space not just for queers, but allies as well.
Right. Okay, thank you. So we will be doing this sort of thing with each assignment. I'm pretty sure by the end of the quarter you'll all get a chance to speak. So that's due. The reports for interviews are due tomorrow, as well as the outlines that you've written. What's due next week are the op-ed article drafts, and if you remember, what you're expected to have is to find a newspaper article on a topic and then respond, because either you feel you have first-person experience. Remind us again what the different op-ed types are.
Narrative. So you have an opinion on
Anniversary.
Event or a solution.
A solution to a problem. So very quickly, tell me what you've done so far. If you've just found an article and you've read it, if you have actually completed the assignment, this is progress reports. So Jenny.
I haven't exactly found an article, but I know like the topic that I want to go into.
Which is?
Is like what kind of role that child life specialists have in the healthcare setting, and like kind of it's like relatively. I feel like it's like relatively new, and like when you tell people like what a child life specialist does, many people are unaware, and like just the importance of having them in the healthcare field, because they provide like emotional support and education and guidance, and they kind of have like this holistic approach, and like how I guess to help like the whole debate of like with funding of like healthcare facilities and like the need for them.
Okay, and that's because your practicum site is child life. So some people ask me, oh, do this have to relate to your practicum sites? The answer is yes, it has to be related. Talene? Yeah.
I haven't exactly found an article, but I'm thinking about, since I'm doing American Heart Association, I'm thinking about finding a piece about exercise and how it can reduce cardiovascular disease. I haven't found anything yet.
Okay, Google News helps. Okay, Jeffrey.
Yeah, I haven't found an article yet, but I'm going to find a piece probably on something that has to do with child development for autism, and maybe something that has to do with environmental factors that affects development.
Okay, that's plenty. It's a current topic. Kiara?
I'm in the OBGYN department, but I'm kind of working with someone in quality and patient safety right now. And so what I want to look up in our for is like the efficacy of using clinical pathways to change like the standard care for patients.
You'd have to pick the keyword carefully to find the current newspaper article. Okay. But it's an important topic. I imagine if you put in something about the healthcare reform and how it will affect, patient satisfaction type things, that would help. Okay, Karen.
No article yet, but I want to pick something that has to do with the new healthcare reform and if it actually lowers costs in the long run.
And your
my
site?
Case management. So a big thing for them is hospital readmission, and I guess
Right.
with the new healthcare reform and stuff like that, if you discharge a patient and you come back within like that 30-day time span, the government doesn't reimburse you, like you're actually penalized for it.
Okay. Thank you. Anybody else having difficulty with this assignment who wants to go? Yeah.
I just have a question. How recent was the article?
Well, it's not that hard to find a recent article on any of these topics. So you can limit, when you do a Google news search, you can tell it to only look at 2013 or in the last 6 months or the last 2 years.
There isn't like a
There is none. I mean, if you find a compelling article, you know, the reason it's called news is that it has to be current. Remember when we went through the guidelines for writing an op-ed? If you're writing about a news story that's 10 years old and you have nothing new to say, it's not going to be published. So your goal is to make it current. So if you find something written in the last month, very likely you will, if you write a good article, it might be published. Yeah. Okay? Any other? So we'll have a short day today. Thank you all for coming, and a big round to our speaker again.